Good afternoon, everyone. This is Dr. Armstrong with today's episode of Matters of the Mind. I have to get used to saying that. If you're liking the content that is being shared on this video, please like, subscribe, and share as we are building this channel organically. And a special thank you to the organizations who use the information in the video for cultural psychology, the APA, the APCE. I do appreciate you for using this content. Today, we're going to dive into what we call a new form of therapy that has been making a few rounds here lately. And I think it is worth a try. And I will be using it actually in my own therapy practice. What we're looking at here is what is called written exposure therapy. Written exposure therapy. Otherwise known as wet therapy, right? Has nothing to do with water, but that is the acronym for it. It is a relatively brief trauma-focused treatment, mainly for those who are experiencing any type of PTSD. Okay, mainly for those who are experiencing any type of PTSD. It was developed as an alternative to the more intensive and longer trauma-focused therapy treatments. A brief overview of the research available starting back as early as 2021 showed that the basic mechanisms of written exposure therapy is where individuals are asked to write about their traumatic events in detail across several sessions. The aim is to confront and process distressing trauma-related memories and to reduce the avoidance of them. Many times when people are traumatized, they tend to avoid talking about the situation. One of the best ways to heal from that is to actually talk about it. Okay? The duration consists about 5 to maybe even 10 sessions, depending on the brunt and the deepness of the trauma. The effectiveness that we have seen in this type of treatment is that studies have shown that the effectiveness of the WET, which is written exposure therapy, in reducing symptoms of PTSD is one, a noticeable randomized controlled trial, in that in this trial, people were able to heal faster. You know, therapy should be all about your healing, not about the therapist seeing how good of a therapist he is, but it should be a partnership. It should be a relationship where healing from the trauma is the number one outcome. Healing, okay? When we look at it, the rationale for using this type of therapy is that from a psychiatric standpoint, and I am not a psychiatrist, but from a psychiatric standpoint, avoidance is a cardinal symptom of PTSD, all right? The individual often engages in cognitive or behavioral strategies to avoid trauma-related stimuli, which perpetuates the disorder. Written exposure therapy is based on the principles of prolonged exposure. Prolonged exposure. Where confronting and processing trauma or traumatic memories can reduce symptoms and even just overall have a gradual diminishing effect, whereas you're not feeling those intent or innate or in-depth symptoms of the trauma. Okay. The act of writing can serve as a form of exposure to any kind of trauma-related stimuli. Okay. The mechanism of action is simple. Write down your thoughts. Write down your thoughts. Writing down your thoughts will actually help you see it in real time. It gives you the opportunity to see on paper what you're writing, to see, hey, look, wow, I didn't realize. It's almost like a journaling. A lot of people journal, a lot of people find comfort in journaling because they're able to put their thoughts in paper, on paper, and as they go back and look at what they're writing, it's like, wow, I was going through all of that, or I am going through all of this. So this therapy is very, very producive, all right, of your thoughts and the healing that can come along with it. Let's move forward. The therapeutic framework. The therapeutic framework, the structured and repetitive nature of written exposure therapy is crucial. Sessions typically begin with standard instructions for the client to recount their trauma in detail, emphasizing their thoughts, feelings, and physical sensations. Over the sessions, clients may develop a more organized or coherent narrative of their traumatic experience, which can serve to integrate the traumatic event into the broader context of their life. All right. In conclusion of this type of therapy, I can remember as a child, my grandmother used to say, if there's something that you want to say, but you can't actually get it out, she would say, write it out. I used that method one time in my own personal life, and to my surprise, it was changing for me, life changing for me. The written exposure therapy allows you to see what you're thinking, process what you're thinking, heal from the trauma, make changes in your life and even in your thought process. Because remember, this is a post-traumatic stress disorder that you are experiencing. We can't go back and change what happened, folks, but we don't have to live in the past. My recommendation to you today, give it a try. Nobody has to know what you're doing, but give it a try. Write down your thoughts, write down your feelings. Ask yourself the questions. Is this relevant to my life today? Are these intrusive thoughts? And if they are, use the ANT method. Okay? Attack negative thoughts. And is this actual based off of the trauma that I experienced? You have to ask yourself all those questions. When you ask yourself all those questions and you're writing them down, your thoughts begin to take on a coherent process. And during that process, you can see, well, I don't think it is as bad as it is, as I'm making it to be. Because a lot of times we make things to be worse than what they are. So today, folks, let's give it a try. Write down your thoughts. Write down how you're feeling. Let's see if we can make sense of all the stuff that's going on in our heads. Thank you, folks. I hope you all have a great day. This has been Dr. Armstrong. Have a wonderful day.